My name is Leroy Brown, and welcome to Bridging the Gap. Tonight we're going to be talking about the Community Provider Fair. And I have some people that are on with me that are experts as to what they do as far as putting this fair on. And what I'm going to do now is ask each one of them to identify who they are and let us know exactly what role they play in the fair and in the community. And I'm going to start on my right, your left, and I'm going to start with Colleen.
Hi, I'm Colleen Porritt, and I'm the school social worker at Jane Addams Middle School. I've been at Jane Addams for about 11 years, and I'm co-chair to the committee.
Okay, Mary.
Hi, I'm Mary Davis, and I'm social worker at Brooks Middle School, and I've been with the Resource Fair for probably the last 6 years, I would say. And this year we're having the Resource Fair again on Tuesday, February 21st from 8:30 to 1. And I want to make it another great year with these fabulous people that we've all collaborated with and worked so hard to make this fair possible for the community.
Okay, Alan.
Hi, I'm Alan Bank. I'm a co-chair as well and district representative for Plainfield School District 202. I'm a social worker there for Plainfield High School Central Campus. And yes, I strongly encourage everybody to come and enjoy the fair. Once again, yes, it'll be on February 21st at the Romeoville Recreation Center.
Carlos.
Hello, my name is Carlos Aquino. I'm a clinical director for Aquino Clinical Services, also a clinical director in health services for University of St. Francis. I'm also a provider and a proud supporter of the fair. I would also like to make a brief message to the Latino population. Por favor, no se olviden de atender a la Feria de Recursos, que sería el 21 de febrero, y de 8:30 a 1. Gracias.
And the fair is going to be on what date now, Colleen?
Tuesday, February 21st at the Romeoville Recreation Center.
And it starts at what time?
It starts from 8:30 to 1 o'clock, and we are going to have child care available from 9 o'clock till noon, and it's just $1 per hour or $1 per child.
Okay, thank you.
And then also, if the community or providers have any questions, they can call 815-886-2700 and press extension 802 to leave a message in English, and 803 if you're Spanish speaking, and someone from the district will get back to you as soon as possible to answer your questions or to set up a table for you if you wish to be a provider still in the fair until about the end of January, at the end of this month.
Okay, and it's their website.
Yes, there's a website. The Plainfield School District website is psd202.org, and the Valley View website is vvsd.org.
Okay, thank you.
Beyond high school, and then even beyond that, just helping with their parents. So we start off with that, and then, you know what, we needed to include the community. The community is such a huge piece to this. The population, with the challenges that are going on now, you know, are they any worse than they were a year ago? Well, you know what, they are. There's no doubt about it. And that continual strain puts families at a great deal of stress and causes difficulties for them to provide for their children. And when the children are having difficulty with their needs being met, we see the struggles here in the school systems. So once again, yeah, the school systems are heavily involved, and so we see that as a primary focus. But we do our best not to lose sight that there's plenty of people in the community that are going to need the assistance as well.
And kind of piggybacking off that, Carlos, when you talk about the school system, is that because it has what they consider a larger population of people that may have a need?
Correct. And then there's the students, as Ellen was saying. So things have been changing, you know, progressing, and sometimes, in most cases, it's been progressively getting worse. Mm-hmm. And the less of the focus has been on education. So just to make sure that we have the forefront of education in everyone's mind, and letting them know that it's still accessible. One of the nice things too, that's for the youth and more of the adolescents and juniors and seniors in high school, of trying to determine what do they want to do, what career path or trade do they want to go through. And coming to this resource fair, it's nice because there is an eclectic, and we keep using that word, an eclectic, but that's what it is. It's a vast amount of providers where they can actually be approached. and inquire about what is it like to work in this field. So they have that opportunity as well.
So brings into another question. You have some young people that want to attend this fair because they're looking for something that could probably motivate them or get them involved into what they'd like to do in the future as far as their career is concerned. Will there be people that will be able to sit down with them and say, if someone says, well, I want to be an engineer and I just need to know the right path to take, the people to talk to, or will there be people like that to do that?
Absolutely. There are going to be representatives from various colleges. So if college is the avenue that they want to go, there's representation there. There's also representation if they choose to get their GED, if perhaps they didn't complete high school. There's also representation for those who might want to go to welding school or drive a forklift, and they can get information about certification programs. And it's, you know, the fee for something like that is somewhere in the realm of $30 to go through the training program and, you know, hopefully get a job from that. So, you know, there's a wide array, something for everybody.
Well, this is great because you just brought this more home, you know, because this isn't always about someone's physical needs, you know, where there is a hunger there. It's also an educational need. And I'm sure there are people that will be looking for that as well, as far as the provider is concerned. But I see you have a number of hospitals. What can people expect to come to the fair and learn medical? Because you have a number of hospitals as far as your sponsors.
Right, and last year, I remember one of the particular hospitals, they had a quick little screener, and they had a quick little question and answer. They've encouraged people to sign up for like yearly physicals and things that they need to be doing. There's all kinds of pamphlets and information about how to keep yourself healthy. Just information in regards to that. They've had some fun little things that they've handed out for people for reminders on how to help keep yourself healthy or how to keep yourself safe.
And it's also a great deal of both prevention and intervention. You know, some families have individuals in their family that are struggling with depression or are struggling with chemical dependency, shopping addictions, things like that. There are hospitals that represent each of those areas to get them the help that they need. And just to, it can range from inpatient therapies to, you know, coming once a week or doing a support group. And they're there to provide that information.
You know, Leroy, earlier you kind of asked us about when people come in and what's the benefit of them coming in. As a school social worker, I'm very used to linking families up with some local area community resources or giving them some ideas or understanding a little bit about the family and maybe where they can use some help or assistance. But oftentimes all I hand them is a piece of paper and I tell them here's a phone number or here's a website or you can try emailing this person. But if they can come in and I can walk them over or introduce them to someone, and as we've mentioned earlier, it just takes that initial maybe fear, or maybe you need the strength or the courage to go up and ask someone for the help or the assistance or just to collect more information, even if you're just going to store it away for later. But sometimes that person-to-person contact, I think we all hate sometimes when you get in that voicemail and you're stuck with, you know, push number 1 or push this extension. If you can go up to the person and have person-to-person very real contact, and then you're probably more likely to follow through and to get the help or the services or just the questions answered.
Now, Alan, what kind of feedback are you getting from the providers themselves from this fair?
We find that many of the providers are very happy with the fair. Last year, certainly because we had such a large amount of the community that had shown up, they felt very positive. We've taken feedback each year, and each year it's, is it possible to bring in more of the population? Is it possible to bring in more of the population? We've done it. We've certainly got a great deal of the population in there this past year, and this year we're hoping that it's even more. You've asked questions about, you know, if a person came last year, should they come again? Last year, I know I spoke with somebody who was there for 3 consecutive years, and they said they're planning to come a 4th year. My thought was, great, hey, by the way, bring a neighbor, bring a friend, okay? Word of mouth we know is the best advertising. This is a big benefit because hopefully the community is seeing, you know what, there are a lot of providers there. It's a variety of needs or just a variety of wants. Once again, there's a lot of summer programs that people just want to do. It might not be so much of a need. So you know what? Come there, see what it's about. You can check out the different programs. Last year we had a camp program that came all the way down from Wisconsin that was advertising. So yeah, it's eclectic and it is all around. We, like I said, the primaries, yeah, they are in this immediate area, but we're getting them obviously from out of state as well.
That was another question I was going to have. What are you doing to partner with other school districts, other communities in this fair?
Well, we are partnering with all of Plainfield schools, and they're partnering with us. And I try to get the word out there amongst other colleagues, too, that this is taking place so that the schools in Crest Hill and Lockport will know that this fair is taking place, that other professionals that we know that work in the Joliet schools will know that this is taking place. That's kind of also where the Bugle comes in so valuable to us, because then that's getting out there to reach out to those other schools as well.
Okay, now are there any other school districts that are out there that are looking to partner, you know, that give you a call and say, I've heard about this fair, and is this the only fair that's out there? Is it the only one provider fair that's out there, or are there others?
There are others, but my opinion's biased, and I think we're the best. So. But there are other ones. I don't know, you know, exactly if they advertise in the same way or not. But we certainly have had, you know, as Mary's mentioned, we've had other social workers come in from other districts. We've had social workers come in from Naperville because they know, once again, these resources, they're right in that area as well. Some of the agencies are actually located in Naperville that come down to this provider fair. So it's, once again, because of the vast array that we have, you know, we're not just limited to 2 school districts or 2 smaller areas. It really covers a wide variety. We have not had any other, or I have not actually had any other school districts contact us to say, hey, you know what, we've seen what you're doing, we have some other possibilities, would you be interested in partnering? I'd be open to listening, though, if that is something that they'd be interested in.
Absolutely. And, you know, I do feel that having this show last year was huge because there were other social workers in schools that saw this show and that saw the advertisements in the Bugle and did contact us at the district and say, I would like to come. Do I need to sign up? You know, can I register for attendance? Well, we don't have a registration for attendance because everybody is welcome. But I do respond to any of those people who reach out and contact the district or email us just to say, you know, yes, you're welcome, and please make sure you sign in. We like to have the signatures of all the professionals that come as well as the community, so we know, you know, that you were there and that you enjoyed the fair. And we like it when people take the surveys because that gives us information and feedback on how we can better ourselves for the following year.
And if you got providers, someone that actually want to be a potential provider that's out there, and they may ask the question, is there a monetary registration? Do I have to pay to be part of this fair? Is there something? And again, how do you fundraise for this? I mean, is there a cost factor in putting something like this together?
That in part, in terms of the cost, that in part is where our local communities that have given so much and had donated so much. I know we didn't mention Eli's Cheesecake, but they like to provide dessert for the providers, so that's great. When you talked about some of the fundraising, this year something that we tried that was a little different, we do have a lot of providers, and of course everybody would like a lot of space and a table to themselves, and as much as we would like to give everybody their own table, it's just not feasible when you have close to, you know, 150 or 200 providers. So something we tried this year as a bit of a fundraiser was receiving donations when providers requested a full table to themselves. And it was with some of that money that we were able to purchase the breakfast items, the lunch items, so that way we're not always putting our stressor on the local community to make the donations. We've tried doing a little bit of fundraising that way to help offset the costs.
In addition, certainly the Romeoville Recreation Department, you know, the fact that we were able to use their center, that's something that they volunteer to allow us to do. So that helps a considerable amount. And obviously, yes, they've got a table there as well. They should, because it gets people into their center to see it, and it helps us out so much. Is there a cost to the providers that want to come in to have a table? No, there isn't a cost. So you know what? Once again, this is about the community. This is about seeing how many different agencies and resources we can get in there for that population to be able to absorb, really, is what it amounts to. And we don't expect anybody to absorb all of those resources, but certainly if they can absorb those that they want, then everybody's benefited.
And I notice you have a number of police officers that are there. What can a person look for when they go there to ask the question from a police department? What would they look for?
The police department has focused a lot on prevention. So drug prevention, gang prevention, crime prevention, those sorts of activities, those sorts of resources. And they have little booklets and things like that too for the younger kids, so that will engage them into the prevention process. And I'm sure that any other questions that a community member might have or concerns regarding their neighborhood or that kind of thing, they could definitely talk to the police officer that's there from that area or location, and that police officer would be able to right then and there provide them with the information that they need to do, or the person that they need to contact to get an answer to their question.
What kind of response or what kind of cooperation are you getting from your churches that are involved in both communities?
The churches, when we talk to them, are very appreciative whenever they have the opportunity to come in there and once again let the community know, hey, we're out here, we're available to you, because many times they have resources, there's food pantries and different resources that they utilize within their own buildings that are important, that help members, not necessarily of their own specific congregation, but once again, anybody in the community that might need the assistance. So, you know what, if we get them in there and they're able to share that information, they're happy as well.
And we'd like to encourage the churches to, to come through the fair and to look at the resources that are available so that they can take that back, and give it to the parishioners. And also, like Good Shepherd Church, they have all kinds of resources for utility assistance, housing assistance, clothing assistance, food assistance, and they've worked with us year after year. And we would love to have other churches on board with us too, to contact us or to be able to reach out to them. And one of the things we are going to be doing this year is getting those flyers available to the churches in the area so that they can pass those out to members of the community after services, and also feel free to come themselves to see what the fair is all about.
Well, it looks like you're going to have another hit on your hand again this year. This time is pretty much going by kind of fast, and we knew that it would. So what I want each one of you to do, to look right into the camera and leave the audience with something that you want them to grab hold of and take with them from this taping that they can bring to your fair and benefit from it. And I'm going to start with you, Carlos.
Okay. I'd like to invite everyone to come on to this fair. I mean, we've heard all the great benefits of attending, but one of the things that I'd like for everyone to take with them is, as a provider and attending this fair for the last couple of years, we are a proud sponsor of it, and I can't say enough, or anybody here has said enough, of how wonderful this fair is. So again, if there's any questions or any need, please feel free to stop by my table, and I would do my best to assist anyone.
Would you like to say anything in Spanish?
I don't know where we're going to go.
All right, Alan?
Okay. Yes, certainly I would like to encourage everybody that feels like they may want to find out what's going on out there, what are the needs in the community as far as, whether it's mental health, whether it's programs over the summer, different things that even the school systems might be offering that you're not aware of. But mostly, please come and take a look at what it is that is out there for you. We know that there are a lot of different agencies that are there for you, and that they can help you with just about any need that you have. And if not, odds are they can put you into the right they can put you into the right area in order for that to be taken care of. Many times there's a fear factor involved. We are as inviting as possible. You're not one person among 150 agencies. Last year we had over 190 people from the public come through to take a look and see what there is out there to offer. This year we are sure that there's going to be more. And if you came last year, please bring a neighbor, bring a friend, bring anybody who might need the assistance.
Mary?
Hi, I know that all of you that are watching this right now can take something from this fair with you when you leave, even if it's only our resource guide or a bag of popcorn. We would like to see all of you, whether you are a provider, whether you are a mayor, whether you are someone who is elderly that just wants some socialization or some fun activities, whether you're a parent, a single mom of a couple little children that you want to have some activities for them to do over the summer or during the winter months, whoever you are, I would like you to come out to this fair and see what it's all about. And then I would really like you to take a survey and to give us your feedback on how we can make improvements and how we may have touched your lives. And if you have any fear, as Alan was saying, or any apprehension about coming, there's no need to worry. There's someone that's going to greet you with a big smile at the door when you come in and take you to the table where we'd like you to sign in. And signing in is optional. You don't have to, but we would like to know that you attended our fair. And then they will take you to the table that you choose to go to, or they will let you just say, here, you can have your little bag and go get some goodies and go get some good resources. And we want to see you back again if you were there last year and the year before. And if not, we would love for you to come out this year to share this opportunity with all of us.
Colleen?
I don't know. I think we've kind of covered it. Of course, like you said, we want everyone to come out. There is going to be the popcorn there, or something we kind of forgot to mention is I think there's going to be some guest popcorn poppers that'll be there. So if any of the students or someone wants to come maybe see their superintendent making popcorn, that could be fun. Maybe we could get Mr. Brown to be a guest popcorn popper. Maybe he'll make some for us. But as always, it's meant to be a fun day, a relaxing day, and it is meant for you to come out and get some of the resources in a non-threatening manner and get some of those questions answered, and it's a great first start for you to come out.
Okay, Carlos, would you actually?
Yes. So I'd like to do a little segment in Spanish. Para todos los latinos les invito a que vengan a atender esta Feria de Recursos, que sería el 21 de febrero. Empieza a las 8:30 hasta la 1. Y no se preocupen si necesitan cuidado de niños, va a ser de las 8:30 hasta las 12. Y el costo del cuidado de niños nomás va a ser $1. Vamos a tener varios intérpretes, vamos a tener diferentes recursos. So, por favor, si gustan, no tengan pena de venir y pasar por nuestra mesa. Voy a estar representando los servicios clínicos de Aquino y también la Universidad de San Francisco. So, los invito a todos y los vemos el 21 de febrero.
You know, I want to thank all. That was really great because you don't want to leave out anyone.
Correct.
And this was really great. You guys gave a lot of information. I'm looking forward to it myself, and I'm sure there will be people that are going to be looking forward coming to the fair. I want to thank Larry Randa, who gave a lot of information, got a lot of the message out there through the district, and kept talking to me about it, you know, when we're going to do the taping, when we're going to do the taping. So we have to thank Larry Randa for getting this all spearheaded and getting it out there so we could do this taping. So I want to thank all of you for being here because you do put on a service that benefits a number of people. There are people that are in need, and you've given them a chance to be part and get a benefit from those services that will help their need. And I want to thank our camera people. I mean, this is a volunteer. They volunteer their time, just like the fair, your provider fair. Well, they're providing a service as well to making sure we get this message out to the viewing audience. So I want to thank our camera people for doing everything they do for us, and the people that are in the back, the singers, who are the technical people here. And we want to make sure that everyone have a chance to see this, but most of all, everyone have a chance to come to your fair and benefit from what's going on. Thank you all for being here. Colleen, Mary, Alan, and Carlos, you did a great job.
And thank you for having us and helping us get this word out to communities and even more providers.
Oh, not a problem. If Larry Randa hadn't bugged me so much, you never know, you know. But I just want to thank you all for being here. And this is Bridging the Gap.